In Africa, hundreds of millions of people have not had a COVID vaccine. But there is a small group armed with coolers and white pickup trucks who are trying to do something about it. And their mission will take them miles from home. What are the roads going to be like?
For today, the roads are terrible. We might need a bit of 4x4 driving.
Okay. This is a vaccine convoy run by health organization Right to Care, who send teams down battered tracks in the Eastern Cape in South Africa. The idea is simple. On a continent where only 17% have been vaccinated, it's time to bring the clinic to the people. Our arrival in Lundini was celebrated in song. This is the first time villagers have been offered a jab, and everyone 12 and over was eligible. When we work together, we do wonders, sang the children. Yet the teachers seemed slightly less impressed.
Why did you come so late after a long time, not attending as early as the COVID starts?
It's a good question, but jabs are available in the nearest city. How difficult would it be for the children and their parents to go to Durban to get vaccines?
It would be too difficult because they're far away from us.
That would be very difficult, would it?
Yes.
People here are vulnerable to COVID, but they're also afraid, the fear generating vaccine hesitancy. The effect is dramatic. Nearly half the jabs delivered to Africa have gone unused. Here, Nurse Lubando tries to reassure a group of youngsters. All these myths you hear, it's nothing like that, she says.
They said sometimes the government wants to eliminate because of the...
She pointed to her skin.
We are too much, ne? Then the government wanted to...
You mean
yes.
black people?
Yes, they said so. So
the government wants to get rid of black people. Right.
Then we're trying to tell them that there is no such. Are you guys sure you are going to vaccinate?
Yes.
All of us?
Yes.
Yes.
You don't sound very excited.
We all underestimated the level of mistrust, the fears, the use of social media amongst young people to spread misinformation.
Hina Brambutt is from the US Development Agency, which funds this program.
But if you get them to people, people are likely to get vaccinated. So we're finding higher uptake in rural compared to urban settings in South Africa because these populations have continued to have unequal or in many cases no access to vaccinations. And now that we're getting them to people, you can see people lining up for vaccinations. You barely see this in urban settings in South Africa anymore.
But it takes a lot of work to get people vaccinated. Right to Care have to send their trucks and their people into the hills, and it's a delicate business. Have you had your vaccinations? They ask. Then they meet a traditional healer called a Sangoma and ask if she's had a jab. But she won't speak until they lay a few coins at her feet. To their surprise, the Sangoma says she's fully vaccinated. But there are some who don't want to know about it. This woman said the first dose made her sick. I said, I'm done, she cried.
Oh, okay, Mom.
This is pretty typical, is it?
She was shouting and all that, expressing that she doesn't want to do it. Yeah. So, this type of situations, you don't know. You just have to let them slide.
In South Africa, more than half the adult population are still unvaccinated as the country enters its fifth wave of infection, a wave that's sure to spread through Africa. But the continent's unprepared and millions unconvinced about the threat they face. John Sparks, Sky News in the Eastern Cape.